Welcome to the office.
Bienvenidos.
Gracias, gracias.
Nice to meet you. Mucho gusto.
Mucho gusto estar aquí y pienso irme muy bien de mi problema porque son muchos años ya.
Been suffering a lot.
Yes.
And 38 years ago, you used to work at the Forum here in Inglewood, right? And 38 years ago, he had a injury.
He had an injury.
Is that correct, ma'am?
Yes.
And since then, he's been on disability for 38 years.
Yes.
Is that correct? Okay. And then you guys moved to Texas?
Yes.
So right now, you're coming from San
From
Antonio.
San Antonio, Texas.
Understood. And your dad has a lot of stuff going on right now.
Yes.
He has neck issues, mid back, low back, correct?
Correct.
What else is going on?
He has issues walking. He's unbalanced. He gets tired very easily. He gets dizzy when he walks.
And he found me,
Yes.
but he don't understand what I'm saying.
He does not.
But so what was it about? He don't understand me. How did he say, let's go see this guy?
He came
I'm
across
curious.
your
I'm
video.
actually
Yeah.
curious.
He came across your
Es
videos on YouTube.
Es curioso eso, me han dicho, ¿cómo sabes? Él habla inglés, tú no hablas inglés, ok. Lo que yo veo cómo trata a la persona cuando le dice qué es lo que tiene, qué es lo que trae, no sabe, no entiende.
It
Okay.
bases off of what he sees because he doesn't understand what you're saying, but he
Sí.
bases off of what he sees.
Energy.
Ningún quiropráctico, yo veo diferentes, ¿cómo se llaman? Videos,
He's watched several other
Diferentes
videos
videos,
with
pero
several
nadie-
other doctors,
como
but none
Rahim.
like you.
Nadie, eso es una gran diferencia y por eso dije yo voy. Mucha gente dice no porque es quiropráctico, todos son iguales, no.
So
Este es diferente.
he's basing it off of the reactions that people give in the videos, how they're so happy, they feel relieved, and he feels like you will be able to help him.
And he wants some of that.
Yes, he does.
Okay, fair enough. Bueno. I'm gonna go over your x-rays. You can come behind there so you can listen and explain to him at some point. I am recording it, so you'll have something to look at.
Hace ya un tiempo ya que me está doliendo la cadera y se me entumen las piernas. No era antes, pero ya llevo tiempo que...
¿Por cuánto tiempo?
Hace un año que
This is about
me
a year
duele.
ago.
Me duele y luego me entume con dolor.
He said that about a year ago he started experiencing the lower back pain, and then his legs would get numb.
Both legs?
Both legs.
Numb meaning no feeling, or pins and needles buzzing sensation? Es diferente.
Intumido como que no tiene sentido de las piernas o como que te están picando agujas.
No, ni agujas ni nada de eso, no. Es dolor y entumido.
Okay, so numbness, like no feeling, and then pain as well.
Okay, I'm pretty sure it's buzzing. Okay. All right, because true numbness will be painful before it gets better, okay? And a lot of times, a lot of people tell me numbness, but it's not really numbness. It's a buzzing or it's a falling asleep of the body part.
Okay.
And if it is truly numb, then the area that is truly numb will hurt. And if he is going from numb to hurt, it's on the borderline right now. So hopefully that should be easier to fix.
Okay.
Hopefully. Okay. All right. So he's like everyone's papa, right?
Yes, he is.
He's like everyone's tío, right?
He is.
He's like is he abuelito?
Yes, he is.
And he's abuelito. He's papi, he's tío, he's abuelito. Cool. So you got a lot of people that depend on you, right?
He does.
See, he understands me though.
Yes, he does.
Okay. Let's get started. I'm gonna go over your x-rays, tell you what I see, then we'll start your exam, and we'll get started. This is his side profile. On the side profile, we're looking at 60-degree curves. This should be a forward curve, backward curve, forward curve. Okay?
Okay.
That's number one. Number two is, let's look at his posture. And there's the first issue we can see. He carries his upper body behind his foundation. This is his building. So this is Gonzalo's 24-story building. And in order to have a stable building, we need to have a level base and foundation of the building. And that's what we're going to evaluate. But whatever's happened down here, you can see that the body has compensated over the years. My business isn't to straighten this out. That's not my business. My business is, do we have a level foundation, things to hold, and do we have the right curves on this side, and how are the discs? If we have the right curve and posture here, then whatever that is the person's normal. Okay? Now, let's start with the foundation and all of this stuff here. And what are some of the things that we can see? Let's look at his foundation. And we can see there is some tilting going on here. His L5 is very low down in his pelvis, guys. And it's not a good thing or a bad thing. It means he won't do well with a push move. He needs a pull move, or he can do knee, chest, Hylo. But side posture push is almost impossible on this guy. As you can see, you can't get your hand in there to contact it. So what we see here is this. This is the crease of his bum. This is the pubic bone. So he's tilted and he's turned. And I guess let me put the numbers up. It's going to make more sense. What happened, or whatever happened here, was this. We have a rotated pelvis on the left side with a rotated sacrum on the left side, but it's dropped on the right because of whatever injury happened. Okay. So is doing this. Izquierda is going in this way. Tailbone sacrum goes back. So his body is favoring to the left. But his short leg and short sacrum wants to bring him back to the right. So I'm sure he got a little bit of that wiggle and waddle when he walks, kind of side to side,
yes.
right?
Yes, definitely.
Yeah, I'm sure he has that. Okay. So we need to decide where we're going to start, either on the sacrum or the pelvis, probably down in the tailbone. So whatever's going on here, this is all compensation. He had his gallbladder removed. We need to talk about his digestion. Yes, gallbladder removed?
Mm-hmm. Yes.
We need to talk about his digestion and what he needs to do for it. We have some arthritic changes. Again, this is wear and tear, dude. He's played hard, worked hard. Mm. So our job here is to figure out what can we do in this period of time to stabilize it. That's really going to be our goal. Are we going to fix all of this in 2 weeks? No. But we're going to get him stable and functioning and quality of life. Okay? And along the way, he's going to have his aches and pains, and that's it. What I'm looking for after today, whatever is different. Not good, not bad, just different. Okay? Let's talk about his discs here, because this is where the fun starts. Now the fun starts. Okay. So this is 5. You can see 4. Yeah. 4 is thin. We're getting a vacuum cleft sign. It's degenerated, but we're hoping these two should fuse together naturally. There's no surgery for that thing. Okay. But know that this thing is going to fuse together, and let it fuse. Okay? But look what's happening here. And this is what's interesting. Dude, that's crazy. This is awesome. So from afar, it looks like, look, L2 is back, but it almost looks like this thing is a L4, 5 spondy together. You know what I'm going to probably need to do at some point later this week? And I'll take care of it. I'll probably do another motion study x-ray of the lumbar spine, have him bend, and do it and just include it. I'm okay for today, but I think I want to do it to give a definitive answer on something. Okay, because these two will probably fuse together. What I need to see is this. If we flex forward, do these move as a unit? Are they stuck together? Is it even moving? I don't know yet. I see us starting down here though, either S1, S2, S3, S4 is swollen, S1 is swollen. So in the basement of the building, number 1 and number 4. And then once that's sorted out, then we got to see what we can do here. Maybe we get to this now. I don't know. These discs are good. Good. These are good. Little arthritic changes there. Discs are good. Now we get to the neck. So the issue is this. This stuff is all fusing. But this is what I don't like. Okay? Because when you can see there's a hard abrupt kink here. We need to get movement in this part of the cervical spine. Let me show you what I'm talking about. So in extension, you can see he doesn't have a lot of extension. It's very stiff, and that binds 2, 3, 4. He gets shortness of breath, right?
Yes.
Yes. He gets. Does he get angry? Anxiety? He gets gussa. He has a lot of anger, yes. Right? Yeah. How do I know this? Now, here's another answer. In flexion, he moves forward. There's a you see these all connect in the back?
Mm-hmm.
This one moves forward. You see that?
Yes.
This is hypermobile. And the reason this is ligament instability. We don't need to touch this area. Okay? We need to stabilize down here. What I see is this one here. Now, 2, 3, 4, 5, 6, 7. Actually, T1. 7 is posterior, but it's actually anterior. It's tilting back. But you can see it's actually anterior to T1. So T1 is our culprit. So let's put some stuff together, what I see here. T1 is an issue here. We got to talk about his digestion too. He likes his carnitas, right? You like your carnitas? You like carnitas?
Me
Huh?
gustan las carnitas.
What does he eat?
Sí,
He
sí.
likes his carnitas, dude.
Pero sí.
No more
Pregúntale a la
carnitas.
vértebra.
The vertebra. Oh, he did have a question.
Yes.
He said that he was told years ago that he had an extra vertebrae. Do you see
An
that?
extra
An
vertebrae?
Extra.
Well, that's a good question. 1, 2, 3, 4, 5. He doesn't have an extra vertebrae. He has a transitional vertebrae. And I will explain. So if we look here, let's count. 1, 2, 3, T1. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 1, 2, 3, 4. That's 5. So remember how I said his 5 was really low?
Mm-hmm.
That's his transition vertebrae. Or does he really have 6?
No.
So if we do go based on that, if that is 5, that's 1, 2, 3, 4, 5. No, the coccyx is there. 1, 2, 3, 4, 5. Maybe he does. Are you kidding? Who are you people? He has an extra lumbar.
Sí. Dice que sí.
He really does.
Sí.
Sí.
It's usually a transitional segment, dude. This is what I'm tripping on. Because transitional segment, this is not a transitional segment. No kidding. Take a look and make sure I'm not hallucinating, dude. That's a bone right there. 5, 4, 3, 2, 1. Let's try something else. Let's go back over here. 5, 4, 3, 2, 1. 12, 11. 5, 4, 3, 2, 1. 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. This jigga got an extra lumbar. It really is. This is the first time I've seen it. No, the reason why is it's normally a transition where L5 takes on the characteristic of a lumbar, or S1 takes on the characteristic of, L5 takes on the characteristic of the sacrum, or S1 takes on the characteristic of the lumbar. That's not his case. And I have 2 cases that have 13 thoracics. This is the first case I've had that has actually a true 6 lumbars.
Dice que es primera vez que
Right
ve
on.
eso.
God gave you extra nerve. He gave you extra pair of nerves. Good. Shukran. Good job. Wow. Now it kind of makes more sense. This is 1. Wow. Okay. We'll do it. Digestion. Last thing I want to talk about. Sorry. His digestion we're going to need to work on while he's here. There is something I'm going to need to give him, and when you go back, I'm going to have him cleanse out for 15 days and get all this inflammation out of his body, okay?
Okay.
We don't need to do that here, though, while he's
Okay.
here. All right, let's go ahead and start the exam. Go ahead and walk to the corner of the room and back. ¿Duele when he walks? ¿Dónde?
¿Te duele ahorita? ¿A dónde?
¿Dónde?
¿Qué?
Que si te duele ahorita que estás
¿Me
caminando.
duele?
Ajá.
Me duele esta parte que es la derecha, lo que es del cuello, esta parte más que todo. Todo me duele, pero esto mucho más.
He said on the right side and then his neck as well.
Starting at the base of the neck.
Okay. qué estado vino la morena que venía bien mala?
10 points. T67, 5 points. Left side, that's his digestion. 7 points. Now let's see what's going on. S3, S4, T6, T1. Holy carnal. Static palpation, running my fingers down the spine. 1, 2, 3, 4, 5. Duele 6 or 7. 6 or 5. 6. 6. 1. 1, 6. Ay, 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 ay. Número 5. Oh, sorry, número 6. ¿Duele?
No.
1, 2, 3, or 4.
¿Cuál te duele más?
3 or 2. Ok. 1, 2 or 3.
3 parece.
4,
También.
5. 4.
Pues los que me han hecho, diga, son L4, L5 lo que me han hecho.
Pero él está esperando la cual te duele ahorita que te estaba agarrando.
Okay.
El 3 o el 4.
3 over 4? Which one's more, 3 or 4?
¿Cuál? ¿3 o 4 te dolía más?
3.
El 3. Great.
Which is really S4 because he got 6 lumbars. Okay. Okay. No problem. So here's what we're going to do for today. We're going to work on his foundation. That's number 1. And his T6. I'll have him walk after that. We'll compare. Then we'll do his neck. After I do that, I'll tune up his shoulders, ears. I'll work on his feet today. No knees today.
Okay.
Okay, not on the first visit for him. And you're here for over a week, so we have a little bit of time.
Okay.
Okay? Listo?
Listo.
Órale. Let's go. Boca abajo, señor. Para Sasha. We need backup. Más arriba. We need backup. You can breathe okay?
¿Puedes respirar bien?
Respira bien. Sí. Bueno. Palms up. Receive. Palms up.
Palms
Palms
up.
up.
Las palmas arriba, así.
¿Lo qué?
Las palmas
Sí.
para arriba. Sí, está bien.
Rotated left. Número 4. With a counterclockwise torque. God gave him an extra bone too, dude. Spire. Sáquelo. Spire. Sáquelo. Otra vez. Sáquelo. Bueno. Uy, poquito. There you go. Thanks, Shasha. Gotcha. Bueno. Señor. Bien. Caminas. Mira. Caminas. What's that? You can smile, dude. It's okay. Siéntate aquí. All the way back, sir. T1. There we go. Look up. There you go. Gotcha. Caminas. That's nice. Am I hallucinating or is walking better?
He's walking better.
Mejor?
Sí.
He doesn't know? Dang. Diferente. Face down, boca abajo. ¿Duele? ¿Duele? ¿Sí? Poco. Gotcha. Nice. That's where we're going to start. Okay. Caminas. There you go. Sure. Es diferente. What's different for him in his
¿Qué-
words?
¿Qué se siente diferente?
Más flojo al caminar, cuerpo ya está mejor.
He feels more loose.
Sí.
Bueno,
Era
para
para-
atrás. Dígame. What is that?
It's more free, more loose. It's not as tight as it used to be.
Starting at the base of the neck. And back is clear. Sacrum is clear. T1 is clear. Now let's test this. If he remembers what it felt like. Mejor. Uno. Dos. Tres. Cuatro. What? No flinching, right? Para, cha, pa. Shoulders. Relax. There you go. Boca arriba. Yes, talus, medial tilt. Okay. Siéntate. Siéntate, por favor. Good time, sir. Now the buff and polish. This is vibration therapy. It's to break up scar tissue. Things have been like that for a long time. That's where we're going to start with him. That was S3, S4, T6, T1. Walk it off, sir. Let me open the back of the gown so we have something to compare to. ¿Qué fue? ¿No? ¿Sure?
Eso del balanceo, quién sabe por qué, pero está mal.
¿De qué?
El balanceo del camino, siempre he tenido eso.
Now you want to see the magic?
Pero no está como antes.
What does he say?
He's always just kind of felt off balance.
That's okay. How's the pain?
No.
No pain?
Okay.
No pain? Siéntate aquí. Take your socks off, please.
¿Qué los calcetines?
Alright, these are my magic socks.
Son tantos
I'm
años.
going to give him a pair, okay? And the reason I'm doing that for him, this is not going to fix the problem, but it's going to help him move better so he can heal faster. And the technology is this. This is the technology, this little red strip. And what it does is activated reflexology points. Less back pain, more ankle stability. more trunk range of motion. Okay? Go ahead and put the socks on. And while he's getting his movement, wear these. Does he have any balance issues at night? Does he get up to go to the bathroom?
No, not often.
Okay. I give these for my elderly patients and people who get up in the middle of the night, fear of falling. And this red strip, senor, is going to go at the bottom. Okay. So the idea with these socks is he's going to be able to get more walking, more movement. He's also going to be able to sit and stand a lot easier. You'll see. Don't ask me to explain the whole science behind it. It just works. Okay, mira. Check it out. Walk 2-3 times and ask him, does he feel more stable now?
Otra vez.
Diferente? One more time. Cool. That's where we're going to start, okay? So,
¿Te sientes más estable, más balanceado?
keep going. One more time. Uno más. So what's interesting with him is this. He's got the dropped sacrum, dropped hip. But his instability that he's presenting with seems more than what the number says. Okay? And the idea right now is just get him walking, get him moving the best you can. Okay? If he's got sharp pains and he says it hurts, then you can stop.
Okay.
I don't want him walking through the pain.
Dile que yo vi el video también de la señora policía que vino. Se
¿Eh?
fue. Muy bien.
He's talking about the video that he saw, a female police officer that came in.
La señora cuando le tronó el cuello se quedó sudando.
Siéntate aquí.
Se arregló.
Mira. Bueno. Bueno.
Sí.
Bueno.
Poquito dolor.
Bueno. Okay. All right, that's where we're going to start. I'll see him on Wednesday.
Okay.
We'll do 2 on Wednesday, and we'll go from there.
Okay.
Okay? Stand up for me, please. Aprieta. Bueno. Aprieta. Bueno. Nada. Lunate. Bend the elbow. Relax. Relax.
Doblando.
You know what? There's something hiding still. Have a seat. Have a seat. Something is off. Sit back for me, sir.
Para atrás.
Something's still off, dude. Aquí. ¿Duele?
Sí.
No duele. ¿Duele?
Poquito también.
Mucho duele derecho o izquierda.
Derecho.
Sí. Come over here, please. Yes. More. Right ear down, down. Poco. Right ear down. Poco. Come over here, please. We could have let him go, you know that, right? But we don't do that. Because he's happy. Right? He said he's happy, right?
Yeah.
But it's not it. Still a little bit. Bueno. All right, let's bring him up. That was for his balance. I'm hoping that helps a little bit more. Come off one more time, please. And walk. Bueno? Balance, how's the balance?
Poquito mejor.
Little bit, still a little bit better after that?
Yes.
Bueno, okay. That's where we're gonna start, señor. Bienvenidos
Gracias.
a mi oficina.
Gracias, sí.
Okay.
Vamos a todo hay que trabajar el pensamiento, fe y todo, y lo que hace Rahim es lo bueno.
He's focused.
Huh?
He's focused mentally, spiritually. He knows that you're gonna help him.
Okay, so one day at a time. Okay, señor? Dios los bendiga.